You're watching Rogers TV, St. John's.
Okay, we're ready to go live.
Perfect. You will be hearing music briefly as I transfer the line. I will then proceed with the introduction. Everything that you say from this moment on will be heard in the conference. Please stand by.
Well, good afternoon, everyone.
All participants, please stand by. Your conference is ready to begin. Good afternoon, ladies and gentlemen. Welcome to the press conference call. I would now like to turn the meeting over to Ms. Kathy Dix-Payton. Please go ahead, Ms. Dix-Payton.
Good afternoon, everyone, and welcome to our media availability. This afternoon, we are going to be listening from the Premier, Dr. Janice Fitzgerald, and the Honourable John Hagee, Minister of Health and Community Services. I now turn it over to Premier Ball.
Good afternoon, everyone. And first of all, we will start today's media availability with an update from Dr. Janice Fitzgerald, the Chief Medical Officer of Newfoundland and Labrador.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us virtually today. I want to thank the media for their continued support and for adapting their practices throughout these uncertain times. Please know we are doing this for your health and safety as well as ours. I am here today to advise that since yesterday, we have had 3 new presumptive positive cases of COVID-19 in Newfoundland and Labrador. The 3 cases are women and were within the Eastern Health region. In each of these 3 cases, the public health has initiated contact tracing. 2 cases are known to be related to international travel. The 3rd is still under investigation. I am unable to confirm or release any further details due to privacy concerns. To date, this brings our total case numbers to 9. 3 cases are confirmed and 6 are presumptive. We have seen 5 new cases in the past 2 days. This is not unexpected. We are doing more testing. We are actively looking for contacts. Finding cases means our public health system is working as it should. The mobile testing sites in the 4 regional health authorities will support us in this effort. I want to stress this does not mean that the measures we have put in place are not working. In Newfoundland and Labrador, there have been 970 tests, and of those individuals who have been tested, 961 have been confirmed negative. I want to stress to everyone, if you are sick or feeling unwell, you must stay home. While we are not aware of community spread at this point, we do not want to put anyone at increased risk. We must adhere to the principles of social distancing. As I said yesterday, this means changing your daily routine. It means not gathering with your friends in your home, going out only for essentials, working from home if you can, and avoiding gatherings. I know this is difficult, but it also includes gatherings such as funerals. Wash your hands regularly. Ensure good cough and sneeze practices to protect yourself and others. I want to speak now about our seniors. We know that seniors are particularly vulnerable to this virus. We want to reduce their risk of infection. We should not visit our grandparents or elderly relatives or neighbors at this time. Seniors, too, must practice social distancing. This means not gathering for your usual card games or afternoon tea or coffee. But social distancing does not mean social isolation. As a community, we need to support our seniors, those who may live alone or who are at increased risk, to ensure they feel safe and connected to their community. Calling your family, friends, and neighbors is an excellent way to keep in touch. Call your grandparents to say hello and ask how they're doing. Call your elderly neighbors to see if they need some groceries or medications, but only help them if you are well. Do not go out if you are sick. I understand not visiting grandparents is a significant change to families, but please do your part to help everyone understand that these measures are to help ensure everyone's health and safety during these difficult times. A simple phone call can brighten someone's day. Ask how they're doing and what they might need. We are a province that supports one another, and we can get through this together. This is hard. Since last weekend, we have seen an increased number of cases, and we are at the beginning of this in Newfoundland and Labrador. And while to some, 9 may not seem like a lot, how we behave now will determine how COVID-19 will progress in our province. You must listen to what I'm telling you to do. This is for everyone's health and safety, and everyone must do their part to follow these measures. Thank you.
Thank you, Dr. Fitzgerald. Today, I want to open up by saying, today's news will not always be about someone else. The fact is, tomorrow's news could be about you. It will not always be about someone else. So as we let that sink in for a minute, we realize that we are in extraordinary times. And extraordinary times, well, they call for serious measures. Our government has put in a number of important measures to help prevent and contain the spread of COVID-19. So let me be clear. The guidelines that we've laid out in consultation with Dr. Fitzgerald are not suggestions. They are not recommendations. You must follow those guidelines. Do not go against what your health professionals are saying. The only way that we can stop this is through social distancing and following the rules that we have laid out. We are echoing comments that were made yesterday, but it's important that we remind the entire province, do not socialize in person. That means no house parties, no family gatherings, no dinner parties. And as Dr. Fitzgerald has already said, it's very difficult to ask our loved ones not to attend funerals, but it is an important message that we must send to our province. We know that this is tough for everyone, and I also understand that isolation is hard, but this is about saving lives, about saving your life. In today's world, we have technology available that provides us with a unique ability to call or FaceTime family and friends. Now, many of you know that I'm a grandfather. And like you, I too would love nothing more than to be able to spend time with my family and hug my granddaughter. But I know that in time, not seeing her is the best and the most responsible measure that I can take. I also understand that not being able to work is difficult. Working with the federal government, our government continues to put supports in place to help you. Today, we have announced financial supports for the childcare sector. This support will ensure families do not have to pay fees during the closure period, and the continuation of wages and benefits for staff, including early childhood educators. Our government will provide funding to regulated childcare centers and regulated family care homes. We have always said this crisis could continue for months, so this assistance will be in place until April the 30th and will be reassessed if necessary. In addition, regulated childcare centers will continue to receive their operating grants. Now, to support students, effective March the 30th, we are suspending repayment of provincial portion of student loans. Repayments are suspended until September the 30th. No payment will be required, and interest will not accrue during this time. Additionally, health officers will be stationed at airports in St. John's and Happy Valley Goose Bay. These are the airports that could receive passengers from other provinces. Marine and forestry officers will be stationed at Marine Atlantic. Now, starting tomorrow, these officers will be distributing forms to people which will outline the necessary steps for self-isolation. Also, the provincial government is partnering with the Canadian Red Cross to support people in Newfoundland and Labrador who are impacted by the requirement to self-isolate. If you have concerns or issues arising as a result of you, your loved ones, being in self-isolation, Red Cross will have a range of supports for you through their helpline. The service is available to all residents and visitors in Newfoundland and Labrador that's impacted by the direction to self-isolate to limit the transmission of COVID-19. The number is 1-800-863-6582. We have introduced some strict measures. Are they extreme? Yes, they are. But we have done this as we are currently in the extreme and a very serious situation. As we see the numbers rise, I am saying to all Newfoundlanders and Labradorians, follow the measures that we have put in place. I have to strongly insist, stay inside, stay home. This will not always be about someone else. We will see the impact of people in Newfoundland and Labrador. The numbers will increase. You could be the next person impacted by COVID-19. Our number one priority is your health and your safety. I want to again thank you and all of you who are following the guidelines. Once again, I want to thank our healthcare workers, our first responders, Dr. Fitzgerald, Minister Hagee, and all our officials working very hard behind the scenes to ensure we keep the spread down and ultimately protecting you. Our all-party committee is meeting on a daily basis. And before I go to questions today, I would like to ask Minister Hagee to make a few comments.
Thank you very much, Premier. On a daily basis, Dr. Fitzgerald and her team provide my department and through me the rest of our government with updates on assessments of risk. You've seen the numbers of cases in this province increase. The time is now when we can influence the rate at which those numbers increase. That is important because that determines how readily our healthcare system will be able to respond to those more severely affected who might need hospital and possibly even respiratory interventions. So the distancing piece that my two previous speakers have really emphasized is absolutely crucial. It is not a time for your teenagers to take the car and for 4 or 5 of them to drive around in close confines for 4 hours in the evening. This is going to be hard because that is an age group of individuals who by and large feel that this will not affect them. But it does. We've seen it across the world It affects young people as well as old. The old are more vulnerable, and we obviously will be paying increasing attention to what we need to do further to protect our seniors. Again, we go back to our daily assessment of risk. We have, through public health, some very robust measures. Labrador Grenfell Health, with it being so experienced, unfortunately, in contact tracing, has led the way and actually started the assessment centres a day or so ahead of the rest of the province. We now have drive-through centres by appointment only across the province. I would like to emphasise as well the duration of this. There are increasing calls for us to take ever more drastic measures, which may ultimately be necessary. But remember, what we do now we have to live with until possibly Canada Day. It is important that we, and through us, our seniors are supported in getting essential supplies such as food and utilities. And that will require some of these services to continue, even when there might be calls for them to shut down. There is no way this island can survive, or this province, without regular inputs of food and supplies from outside. Labrador is geographically isolated, and Newfoundland is an island. So what may not appear to be essential today may well become so by the time June rolls around. We have very robust public health legislation, the strongest in the country. So we have been pleased with the results of the recommendations, the orders that Dr. Fitzgerald has issued by and large. But it is incumbent on every one of us, to follow those requests, because they are now no longer requests. They are orders with the force of law. So thank you for those who have followed it, and to those who haven't, I really urge you, for the sake of yourselves, your families, and your communities, to think again. So thank you again for the opportunity to repeat what I feel are those very important messages.
Thank you, Minister. We will now take questions from the media.
Thank you. Our first question is from Marie-Isabelle Rochon with Radio-Canada. Please go ahead.
Yes, I would like to have more detail regarding the individual in Call Funeral Home that was tested later positive with COVID.
I'm sorry, I didn't get the question.
Individual in the funeral home.
I would like to have more detail regarding the individual that attended two funerals at Call Funeral Home this week, and that was later diagnosed with COVID-19.
So Public Health is investigating all the cases that we've had in the past couple of days, and when those details are confirmed, and if there is any follow-up that needs to be done, then Public Health will be doing that follow-up in Eastern.
Thank you.
Why? Okay.
Our next question is from Mark Quinn with CBC St. John's, Newfoundland. Please go ahead.
Yes, hello, thank you. What happens when someone reports a person who's not following self-isolation regulations? I know there's a form for people to fill out. When one of those forms is filled out and sent to government, what happens next?
Currently, Mark, those forms are being collated. As of tomorrow, in cooperation with the Royal Newfoundland Constabulary, there will be personnel sifting through those and undertaking investigations based on the information that's supplied. Thereafter, obviously, they may make some recommendations, and we'll take it from there. So we have a process in place, and that will begin more formally tomorrow.
And as a follow-up, how many reports have been received to date?
The system only went live last night and is in the process of actually being modified to remove the requirement for any paper or scanning. I will get you those numbers. I do not have them to hand now.
Thank you.
Thank you. Our next question is from Andrew Waterman. Please go ahead. Your line is now open.
Hello. I'm with the Telegram. Just wondering, at what point will the province simply run out of money because of all the closures and the loss of income?
Well, as you know, Andrew, we are experiencing, this is a global problem that we're facing right now. On Thursday of next week, we will be in the House of Assembly to bring forward a loan bill. And so right now, we will bring that piece of legislation forward next week. We're working with the federal government. All provinces are working with the federal government. So that for us is not an issue at this point. It's just that we need to get into the House of Assembly later this week to get a formal request for a loan bill.
Thank you. We have no further questions registered at this time. I would now like to turn the meeting back over to Ms. Bix Payton.
Do we have any further questions from reporters? We can continue on if you have any more.
Ms. Payton?
Hi. If you have any further questions, reporters on the line, we can continue on.
Ms. Payton, we cannot hear your line.
Hi. If we have any further questions from the media, we can continue on with the call.
We do have Mary Isabelle Rochon who would like to ask another question from Radio-Canada. Please go ahead.
Yes, wondering more about the tourism industry. It represents a big part of the economy of the province. Is there any plan for the tourist industry? Is there any financing for owners, for business owners?
Yes, there is, and we'll be working with the federal government and with the province, of course, working with our tourism operators within Newfoundland and Labrador, realizing and understanding that it's very difficult for people to travel. It's something that we're discouraging, and for people that visit from outside of Newfoundland and Labrador to self-isolate would make it very difficult to travel to our province. We recognize that. Also, the movement of people around the province is something that we're discouraging. And keeping in mind social distancing and asking people, telling people really to stay inside, it would make it very difficult on tourism operators as well as other business owners. So we as a province and as a federal government will continue to work with the business operators and the employees in Newfoundland and Labrador that are negatively impacted by the decisions that we make as a province and as a federal government.
But you have a concrete measure for them.
Yes, we will. We've already been talking to a number of tourism operators, and just specific for tourism operators only, we could put in measures because many businesses will be impacted, not just those of the tourism industry, but we recognize that this year could be extremely difficult for them, as it could be for other business operators as well. So it's important for us to work with that industry through their association and others to make sure that we put in place that when we get through this as a province and as a country, we have the necessary groups in place to restore the economy in Newfoundland and Labrador and throughout this country.
Do we have any further questions from reporters?
I have another question.
Okay, go ahead.
Yes, wondering why did the Call Funeral Home issue this notice about this person who was at 2 funerals? Why didn't the answer came from the government? Why don't you tell people who were in those events? Sorry, my question don't. Sorry for my English, but I'm just asking, why didn't this information came from you instead of Call Funeral Home?
We have been very clear from people that travel into Newfoundland and Labrador from outside of our province and those that travel from outside the country. We've been very clear in what we have laid out, what the expectation would be for people that travel into our province. So if people are not following those rules, as Minister Hagee and Dr. Fitzgerald said, there are consequences to that behavior. So the information that we've put out there, that Dr. Fitzgerald have put out there, this information is being explored, through, as Dr. Hagee just said, through the public reporting forum and so on. But we're very serious about these measures, and we expect people to take, what we've put in place. We expect people to follow them.
Thank you. Merci. Our next question is from Andrew Waterman. Please go ahead.
Hi. It's my understanding that now with doctors limiting their hours, pharmacists are being asked to renew some medication. Is there any provision set aside for personal protective equipment for pharmacies and their staff?
The issue of pharmacies and personal protective equipment, by and large, falls to the employer. Most of these are actually private or even community businesses. We have, as a department, offered what help we can in terms of supplying that come a request from them. Exactly where that is in terms of a request being received and for what, I can certainly check up for you. But again, we have, through the department, as a province, tried to coordinate the acquisition of PPE for anybody who is a frontline worker who needs it. And our pharmacies are certainly an important role in keeping our population as healthy as they can. We saw that in the snow event in St. John's, and that was a learning for our department, and we're working on that.
One somewhat off that topic, follow-up if you don't mind. How many cases are being isolated in hospital versus at home?
So far, the cases that have been identified are all recovering from home. But the important thing to remember here is the contact with some seniors who are vulnerable in our society. Simply because people are recovering at home does not necessarily mean that you do not take those measures seriously. This could have a significant impact on our vulnerable population. And as Dr. Fitzgerald said, simply we must follow the rules. Because people are recovering at home doesn't necessarily mean that this will always be the case.
Thank you. Our next question is from Mark Quinn with CBC St. John. Please go ahead.
Based on what we're seeing elsewhere in the world, do we have a sense of when the number of cases will peak in Newfoundland?
At the moment, that is difficult to say. Like as I said, we're at the very beginning of this. If we can continue with the social distancing and if people are compliant with the measures, our hope is that we will not see the same increase that has been seen elsewhere. However, how we behave right now will determine what the progress of this outbreak will be.
And as a follow-up, can you say if you expect there will be hundreds of cases or thousands of cases in Newfoundland and Labrador?
At this time, certainly, I expect we will see more cases. I will not be surprised to see in the double digits of cases in the near future, but how high that will go is difficult at this time to predict. Again, I would emphasize the importance of staying at home, going out only when necessary, following the rules, avoiding mass gatherings to help to prevent the spread of this virus.
Thank you. Our next question is from Andrew Waterman. Please go ahead.
With regard to the public report form, I know that there's a sense of stress and panic out there right now amongst certain people. I've heard from a number of people that there is the fear that neighbors will, or not necessarily neighbors, but just people will be putting this report in, and it might be based on rumor, it might be based on hearsay. How is the government going to make sure that the information they are receiving is accurate and not violating someone's privacy or anything like that?
The form has been devised, such as it is, to give a fairly basic set of information that leaves identifiable features. So, names, locations, and this kind of thing. It would then be down to the individuals looking at those forms to decide how to investigate that and to verify that information. Some of the challenges are around the detail. Prior to the federal government changing its requirements about self-isolation versus self-monitoring, someone could still be eligible, as it were, to be out and about on the basis of the previous recommendations are not necessarily in breach of any orders that we have made. So it will require individual assessment, and that's going to be a bit of a challenge from resources, but we've had discussions and we have staff ready to start on that process.
Operator, could you explain to the reporters the process for asking questions? I'm getting emails from reporters saying they are unable to get into the system.
Yes, so once again, please press *1 on your telephone keypad if you'd like to ask a question. If you're on a speakerphone, please lift your handset before making your selection.
Thank you.
Our next question is from Ben Murphy with the OCM News. Please go ahead.
Thanks. We have called a public health emergency, but now we've seen even places like Nova Scotia implementing a state of emergency, and a lot of people are calling for a state of emergency to crack down on this social distancing, and especially after hearing like the parties that happened over the weekend. Are we considering implementing a state of emergency here?
Well, from the point of view of the health legislation, we have the most stringent orders that are possible compared with other jurisdictions. We look on a daily basis at the level of risk that we face and what options are there. If we find that there are things that Dr. Fitzgerald and her team recommend that we cannot enact under an order under the Public Health Emergencies provision, then we would certainly look to the Emergency Services Act, which would allow us some other options. But at the moment, we haven't passed that threshold. If we do, then we'll go down that road.
And as a follow-up, Premier, just looking for an update on the offshore. Are these rigs operating as per usual? What precautions are in place for the workers, as we're hearing lots of concerns about people having to self-isolate for 14 days once they come back? But what about international workers who are going to platforms like Hibernia?
Yeah, so if you're working on a rig offshore Newfoundland and Labrador, and you're returning to Newfoundland and Labrador, that is part of the province, that is part of our jurisdiction. So you're not there seen as leaving Newfoundland and Labrador. So if you come off the rig, come to the province, well, then that is no different than going to work inside the province, as some people are doing so today. So the provisions that are required on the restrictive measures, they apply to the offshore rigs as well. But if you're a Newfoundlander and Labradorian working on a rig, coming to the province, there's no need there to self-isolate. If you leave the province and come back into the province, well, then there's a need to self-isolate, just like those that would work on those rigs from outside Newfoundland and Labrador. Now, for the Alberta workers, I want to be very clear, and those that work outside our province, there were some questions raised about that yesterday. Well, then you are not in the province. When you return, you must self-isolate.
Thank you. Our next question is from Mark Quinn with CBC St. John's. Please go ahead.
Yes, I understand there are more than 300 Newfoundlanders and Labradorians in Doha, and many more Canadians. Is anything being done to help? And I understand there also are cases of this novel coronavirus there as well. Is anything being done to help those Newfoundlanders who are in Doha?
Well, right now, through the national government and through the federal government in getting people repatriated or coming back to Canada, many of them are Newfoundlanders and Labradorians, and they come from other provinces as well. So right now, I know the federal government is working with Canadians that are outside of the country, putting in measures to get them back home, and a number of measures are already being in place to get the Canadians back to Canada, and that would include Newfoundlanders and Labradorians back to Newfoundland and Labrador.
Thank you.
Operator, could we take a question from Jody Cook of NTV?
And our next question is from Jody Cook from NTV. Please go ahead.
Hi there. Sorry, I've been trying to get on the line for some time, but haven't had much luck, so I appreciate that for facilitating. We've been hearing about other countries and provinces who have been ordering more ventilators. Here in this province, do we have enough staff to operate these machines if, in fact, we do get more ventilators in?
That's an excellent question, one we hope we never have to answer in practice, but certainly something we are looking at. We have looked at our inventory of ventilators. We have 50% more ventilators than we do nominal ICU beds, but we also have the opportunity to increase the number of beds. I think one of the things that we have done is to look to the Health Professionals Council to look particularly for recently retired respiratory therapists and to see who else might have those skills, such as the cardiac perfusionist, for example, at the Health Science Centre, who could be called in to assist. Ventilator therapy is, if you like, prescribed by physicians, but actually administered by respiratory therapists who are a key part of our ICU health system, as well as the broader acute care system. That we recognize as a pressure point, and that we're certainly working on. But again, we're working also with the RNU and the College of Physicians of Surgeons, the College of Registered Nurses and the College of Physicians and Surgeons to identify recently retired personnel who would be available to come back. So we have some options there, as well as diverting resources away from other less pressured areas as the elective work winds down.
Okay, I've got a follow-up question if I have the opportunity. We know that there's a lot of anxieties by way of our pregnant population and those who are preparing for delivery, whether it be in days or months from now. And we also know that the province has come to the decision to not consider doulas a part of the healthcare team moving forward. So with the doulas not allowed in the labor and delivery ward, obviously this has an implication for new families with home births. How are we planning to proceed there?
I think the issue of doulas is that a woman in the case room is allowed a choice of coaches or support. Unfortunately, given the restrictions on visiting at the moment, that is not as broad a choice as they would otherwise have. But certainly if a woman particularly wanted a doula in with her during delivery, that is not prohibited as such. It's a numbers issue. From the point of view of deliveries, we have in this province no reliable, safe system yet for home deliveries. We're working on that, but that was some considerable time down the road, really. What we would do is we would make sure, as far as possible, that the case rooms and the lying-in rooms would be protected areas as far as possible within the confines of the acute care facility.
Thank you. Our next question is from Ben Murphy with the OCM News. Please go ahead.
Mr. Haggie, non-medical staff at Eastern Health are being told not to wear masks when they report for work because it will instill fear. Can you speak to that?
I can't speak to the logic behind it. In terms of the fear piece, what I can tell you is that for routine interactions, the person who should wear the mask is the person who actually has the virus, not the other person. One of the problems you see about people in airports is the wearing of masks in those kind of settings is actually, scientifically speaking, of no benefit to an asymptomatic well person wearing them. Obviously, if there are particular staff who are in high traffic, high contact areas face-to-face, then other options are there. And I know, for example, in our local hospital here, there is a plexiglass screen, and those kind of distancing methods are effective. So I can't speak to the peculiarities of that particular comment, but that's my general observation on it.
And Dr. Fitzgerald, now with Call's Funeral Home releasing this information today for people to go get tested, and that someone who tested positive for COVID-19 was at the funeral home, we're still releasing very, very little information on anyone who tests positive. Do you think now it's time to maybe start releasing a bit more information rather than having individual businesses do it themselves?
So public health is investigating those cases, and when they feel they need to make such announcements, they will. Sometimes businesses will take it upon themselves to go out on their own, and so public health will make those announcements if need be.
Thank you. Our next question is from Mark Quinn with CBC St. John's. Please go ahead.
Yes, I just want to clarify something. On Wednesday, a public health emergency was announced, and there were fines and possible jail terms announced for, breaking regulations regarding self-isolation. Do those fines and jail terms now apply to things like that we're talking about today, like having parties and visiting seniors? Are those now offenses?
My understanding from the legislation, and we will certainly go back and check it again, is if someone is in breach of an order from the medical officer of health, then those penalties are what was prescribed in the Act we passed in 2018. We have the text of the orders out there, and I think it would then be up to a law enforcement and a court to decide whether or not that constituted an offence under the Act.
Okay, thank you.
Thank you. Our next question is from Andrew Waterman. Please go ahead.
Hi, we've noticed a number of people calling for a state of emergency. A petition, an online petition was sent telegrams away earlier today, which gained almost 3,000 signatures at the moment. I'm just wondering what conditions need to be met, or is there a specific amount of cases that need to happen before a state of emergency would be declared?
I think I would repeat my previous answer. We have some of the most robust public health legislation in the country, the advantage of having an act that is really less than 2 years old. We assess risk on a daily basis with Dr. Fitzgerald and a public health team, and at the moment we haven't reached a situation where we feel that there are things that we cannot do that we need to do within the confines of the emergency and orders that Dr. Fitzgerald could make. Should that situation change, should we find ourselves in a situation where we feel on public health grounds that there are things that are outside the scope, the mandate of a public health emergency, we would certainly look at the Emergency Services Act to see if there was anything in there that would give us the power that we needed. And if we need it, we'll do it.
And Andrew, I would reiterate what Dr. Hagee, Minister Hagee has just said. We have a public health state of emergency in place right now. If we need to advance this to make future decisions, because it may seem restrictive that we cannot do more, we will do whatever it takes. If we need a full-on state of emergency, as you're referring to, we will do that. But right now, under the provisions that we have put in place by some of the most progressive legislation around public health in this country, we can do what's necessary to reduce the spread and contain and delay the spread of COVID-19. So we will not hesitate to take whatever measures that are necessary to protect the people in our province.
Do we have any further questions from Jody Cook or Ben Murphy?
We have a question from Jody Cook and from Mary Isabel Rochon. Our next question is from Jody Cook. Please go ahead.
Hi there. I've got a question regarding the trucking industry. There's still some complication, understanding that this is fluid. If truck drivers are now in isolation because they've been told coming in from another province they have to remain in isolation, yet they still have to leave this province to return with products, that sort of leaves them in some kind of a purgatory. So there's questions there on how they proceed with that by way of keeping our supply chain open.
Well, what we've talked about are the essentials, the things that are necessary for like food and medical supplies and other essential products to come into our province. We've the isolation period for those individuals they're exempted from that. I mean, these are necessary to keep the essential products coming to Newfoundland and Labrador. For people that are returning and leaving the province, regardless of what it is they're traveling with, we have not been notified of any concerns of this. I did speak to to members of the trucking industry when this exemption was put in place. And we recognize, there's things that we will need to look at in the future if something that's essential gets impeded by the exemptions that we put in place, and we're willing to look at all of this. But right now, we're not aware of any products leaving this province would be deemed essential.
Okay, and finally for me, if I could just ask one more. There is a question about the 3 that are confirmed positive. Is the Chief Medical Officer able to comment on how they're doing, how they're feeling, if these are mild symptoms, or if it's a different scenario?
No, the 3 confirmed positive have had mild to moderate symptoms and are all recovering at home.
Thank you.
Thank you. Our next question is from Mary Isabelle Rochon. Please go ahead.
Yes, wondering what's happening with the construction industry. For example, I don't know, the Urgentia construction with Husky, or for example, the Mont campus. How is the government making sure that the social distancing measures are also put in place in the construction industry?
Yeah. So we are working closely through the Minister of Natural Resources and others, and occupational health and safety, to make sure that those contractors are compliant with the restrictions that we put in place and the measures that we are taking. And so right now we understand and we've been talking to in particular with what's happening in Urgentia as an example, and they must be compliant. We will take the necessary steps if we find that they are not. And I think the companies that are involved there, they recognize, and in order for this to proceed, they must do so with social distancing in mind. Also, with the services provided that would be required on a construction site. Things have changed, and these are not normal situations, and not normal in our province right now, not normal anywhere in the world. So we have to make decisions regarding those construction sites. We will do that too, but it's important that contractors, in order to keep people working, in order to keep those projects moving forward, that they must be compliant with the restrictions that are put in place and the measures that we are taking in recent days.
Thank you. Our last question is from Mark Quinn. Please go ahead.
Yes, I've got a question about long-term care facilities. I understand that people at long-term care facilities are allowed 1 visitor per day, which means that a facility with hundreds of residents could have hundreds of visitors. So the question is, why are visitors still being allowed to visit long-term care facilities?
Thank you very much, Mark. That's an important question. And again, this is subject to a daily review, really, by Dr. Fitzgerald and her team, providing us with advice. Currently, the requirements are that these be asymptomatic visitors who have not traveled, and we will review this on a daily basis. The challenge that we've got is it's the one area where I have had as many emails to my department asking that visiting be kept open as I have had asking for visiting to be banned completely. So it's obviously a very emotional subject. People who live in long-term care are usually very keen to have visitors. It's important for their mental and physical well-being, and the staff there advise me that you can see a marked deterioration in the mental and physical health of people who do not get visiting. So it is a very touchy, very difficult area to which there is no easy answer. But at the end of the day, we will make the best decision we can on the evidence of the day, and it's something we look at frequently.
And Mark, Minister Hagee is correct in saying, and this is really about finding a balance for our seniors, typically seniors that live in long-term care homes. And we all recognize the emotional impact when people are disconnected from their families, but yet, keeping in mind that we need to protect the staff that, supply the services and the daily care for those residents as well. So, we will do whatever it takes to protect our healthcare workers. Visitors must be asymptomatic, as Minister Hagee just said, but we also try and find a balance of keeping that family unit and that contact together is important for the health and well-being of those residents of long-term care sites as well.
And just as a quick follow-up, I can see the predicament you're in and how important it is for people to have visitors, But in a case like this, when we're having a pandemic, really, shouldn't we err on the side of safety and prevent visitors, even those who are asymptomatic, I guess, because we don't know for certain that asymptomatic people don't carry the disease and perhaps can help spread it.
No, and you do raise an important point. I think one of the other things that weighs very heavily on my mind is that these restrictions, were we to change them, that lockdown, if you want to use that term, could last for 3 months. That would be a significant problem for some of the people in long-term care and also for their families.
In an effort to provide equal opportunity to all of our reporters, do we have any further questions from Ben Murphy or Jody Cook?
We have one question from Ben Murphy from VOCM News. Please go ahead.
Premier, just looking for a bit more clarification on offshore regulations. You've stated that workers who work within the province are not intended to self-isolate, but what about these international flyers who are on these same rigs and all being housed together?
If they come to Newfoundland and Labrador, there's provisions made, I understand, to get them out of the province, and then they would have to comply with whatever measures are in place in the province that will be their final destination. But what we want to do here is to limit contact with people that live in our province. And if you're a Newfoundlander and Labradorian that will come, to come off a rig and your home is Newfoundland and Labrador, well, there's no need to self-isolate. But if you're staying in this province, then, or for those that international or those from outside of Newfoundland and Labrador, provisions made to get them to their final destination in a very safe manner that would not be, that they would not be interacting with people in our province.
And just a quick follow-up on any non-essential businesses who are still remaining open. Is there going to be any kind of order come down that will force these businesses closed?
So those orders will be reviewed. They have to be reviewed every 5 days, and so they will be reviewed today, and we'll be making any changes that we need to.
Thank you.
Thank you. We have no further questions registered at this time. I would now like to turn the meeting back over to Ms. Dix-Payton.
Thank you, everybody, for attending. The time for questions has ended.
Thank you. The conference has now ended. Please disconnect your line.
I'm happy to say there's 4 in our trio tonight. The lady once asked me, she said, honestly, how many are in your trio? That's what she honestly asked me. And I said, there's 4 in our trio.
How many corner workers do we have here so far? Let's hear you. I tell you, I don't know how you feel, but I'm some darn proud here tonight. Yeah, we've got a little extra fella up here. Anybody who's seen it occasionally, we did have a couple of a tour one time. My son Robert came along with us, so